Good afternoon. I'm Julian Walker. Welcome back to this second part of day one of the Bristol Health Partners Conference. I'm very excited to be hosting the panel this afternoon. We've got some fascinating people on the panel, and it's probably the widest range of experience I think we've ever had on a conference panel for Bristol Health Partners. I'm a psychologist by background and director of research at AWP, the local mental health trust, and I've been fortunate enough to be on the exec of Bristol Health Partners for nearly 10 years, pretty much since its inception. So it's a true pleasure to see the achievements of the team and all the health integration teams and the organisations in achieving academic health science centre status. Like all good health science centres, we are in the process of reflecting on what's been a world-changing pandemic. And the panel this afternoon are going to share with you some of their experiences, thoughts and hopes over the next hour or so. Amongst our guests, we've got quite a range of people. So we have 2 carers, 1 nurse, 2 doctors, a cyclist, a marathon runner, 5 parents, and a small business manager. It's the business that's small, by the way, not the manager. I've no idea how tall the manager is, as I've only met these people on Skype. Much of what they will talk about today is applicable to life more widely than the COVID-19 pandemic. But the focus on COVID-19 is important because of what it's caused us to think about, or perspectives, ideas that we might have changed, and to think about the future, how we should change ourselves as organisations and as a system to improve the future health, equality and hope in Bristol and our surrounding areas. I will now briefly introduce the panel members, but I also will let you know that one of our panel members is deaf. So you will see Nicola currently signing. And this is just a reminder that Nicola and Jordan will be signing during the panel discussion. So to keep our answers brief and to keep them as simple as possible and delivered at a good speed for Nicola and Jordan to cope with. So I really am pleased to introduce our 5 panellists today. I've spoken to them all beforehand. We've probably got about 5 hours of material to fit into the next hour and a bit. But they all come from quite a range of backgrounds, and they've had a fascinating range of experiences. So first is Adam Finn. He's been a doctor, I calculated, for nearly 40 years. He's a consultant paediatrician, a professor of paediatrics at Bristol, and he's an expert in immunisation. He set up the Uncover collaboration, which I'll leave you to look up, but it's aiming to find a vaccine for COVID-19, and there are certain unique things about that Bristol collaboration. Asha Craig, many of you will know, is the Deputy Mayor. She spent 30 years in community leadership, management and politics. She's been the Deputy Mayor since 2017, but in particular, amongst many impressive things she's done, she set up the Stepping Up Leadership programme, which is for people from Black, Asian and minority ethnic backgrounds. And that topic and inequality will come up today. My next guest is Anndeloris Chacon, who's a registered nurse and has been for over 30 years. She became the manager of Bristol Black Carers in 2015. It's an award-winning charity that some of you will know about, and it provides culturally appropriate support for people from BAME backgrounds who care for others. So Anndeloris and Leah are both carers. Leah Ovens is a carer who's worked in numerous care homes and hospital settings in around Bristol. She had COVID herself in April 2020, so that was early on in the pandemic. She's made a good recovery though, and is back at work and is here to talk about her experiences today. Dan Magnus also got COVID-19 early in April, and he's also made a good recovery and he's back at work. He's so back at work, in fact, that he's got to leave early to go and do a shift in the A&E department at the Children's Hospital. He's a consultant in paediatric emergency medicine at the BRI, and in his spare time, he's also set up a global children's charity. So welcome all of you. I'm just going to say something about the questioning process. I'm just going to mention to my colleagues that I can't actually see all our guests on the screen. I'm hoping they're going to come up now. So that's great. I can see Leah. I'm just going to put you up. There we go. Fantastic. I can see everyone. Thank you for joining us. So I am going to start off with a quick fire round of questions. I'll go in the same order that I went in just now. But then we are hoping for a surge of complex and penetrating questions from our audience. And we want them to use Slido. You've been given the instructions for Slido. I'm talking to the audience now. So pop that code in. We can see that over 70 of you have been on it already, but we're keen to get questions for the panel. If you want to ask your question live, we'd be keen to come to you live. So if you put the word live at the beginning of your question on Slido, then we will get you to, I will mention your name. Obviously you need to put your name on as well, and we will unmute your microphone so that you can talk directly to our panel of guests. We're going to try and avoid acronyms and discussion of pub opening times and Dominic Cummings jokes, but apart from that, you can ask the panel anything and get their reflection on what's been going on. So I'll come to you, Adam, first. What's been the biggest change to your life since lockdown?
So I would say the biggest change is that physically I spend almost my entire time alone. Whereas in the past, I spent most of my time on the ward with patients and staff in the office or in the laboratory. I live alone. My children are grown up. My partner lives in Portugal. So working at home basically means being alone. But on the contrary, and fortunately for me, I spend almost my whole time, as I am at the moment, interacting with large numbers of people who I can see and hear. So that mitigates that loneliness, but it is nevertheless a big change to be isolated in that way, and probably relevant to many other people as well, I would guess.
So you're spending sort of 10 hours a day on Zoom like this, are you?
A lot of those kind of meetings, and then a lot of time just working away at the computer or going and taking exercise by myself and you know, isolating myself to protect myself and to protect others, as we all are. That's something we all need to do, but it's quite a change.
Yeah. Asha, how about you? What's been the biggest change for you?
Okay, so I was already very busy being a kind of a politician and a leading politician at that, but I really thought I couldn't get any busier since the advent of video calling. Zoom is my favorite, though you know, it's very much a part of what our new normal is. it's also allowed me to be much more efficient. But the downside of that is being that the team consistently squeezes in as many meetings as they possibly can if they even see a little flutter of a half-hour space in my diary. So I need to manage that much more carefully. But yeah, most definitely the advent of Zoom, and as was just said, I think I'm on Zoom from 8 in the morning. I'm not finishing till 7 o'clock this evening, and I started at 8:30 this morning. So yeah.
Yeah. Yeah, I think we're all missing travel time, aren't we, in our diaries?
Most definitely.
So, thank you, Anndeloris. What's been the biggest change to your life since lockdown?
The biggest change to my life since lockdown is an appreciation for slowing down. Even though I am still busy, it is not the same as actually physically being out there and using the time to appreciate what is. Because, you know, the contact that I had with my service users has now come just down to being a telephone call. And it's not until I started coming back out, my daughter said to me, "Mommy, you're a people person. You didn't realize how much you missed it." So yes, it has allowed me to appreciate that.
Yeah, absolutely. Yeah, that connection between human beings is so important, but also part of the risk, isn't it, of the pandemic?
Yes.
So Leah, I'm going to come to you next. What's been the biggest change to your life since lockdown?
It was hard at first because I was trying to get the agency to give me work, because they kept saying that a lot of things now won't take agency because of the corona, they won't give me any work, but which I think quite hard financially. We're trying to support a family, husband, and we're trying to support each other, so it's been quite hard. Not having as much time to be with my family, and not having enough time to be around, she's going through quite a tough time because she lost my dad this year.
Leah, sorry, Leah, I'm just going to ask you to, I heard the first bit, which is that you had to stop work, but I was going to ask you just to lean into your microphone a little bit more. It was quite difficult to hear you. So sorry, could I ask you just to say that again, please?
So basically at the beginning, once I had COVID, it was quite hard to get back into work because of my disability. It took me 2 months before I could fully recover from COVID. Once I recovered, it was difficult trying to get back into work because the agency was saying that there wasn't enough, that a lot of companies weren't taking agency on because the COVID didn't want it to spread from agencies. So financially, the sales also lost a lot of money due to COVID, and not being able to have time with my family and friends, being very isolated due to the things have changed in that way. Whereas before, when I spent time with my family, I probably had a lot more hours of work than I have now. So yeah, not being able to be with my family really.
Thank you, Leah. I'm just going to see if the technical guys behind the scenes can do anything about your audio, which is quite difficult to hear. I think the gist of what you were saying, if I remember from when we spoke about it previously, was that you had to stop working because you caught COVID-19, and that was particularly problematic because you work in care homes. And then you also talked about the isolation from your family, and both you and your husband had COVID-19, and so that left you quite isolated as a family for at least a couple of months, I think.
Yeah.
So, yeah, so we'll just try and get someone will try and help with your audio, and I'm going to go to Dan. So Dan, that question to you, what's been the biggest change to your life since lockdown?
Thanks, Julian. Yeah, so, and hello, everybody. In contrast to Adam, actually, it's been quite interesting. I guess we kind of have the sort of dubious privilege in the emergency department of kind of all still piling into work every day, whilst also doing our best, obviously, to try and protect ourselves and the public. And so I suppose one thing that's resonated with me and a number of the people I work with is just how much we've had to sort of come together as, you know, almost a bit like a kind of military unit. You know, that sort of palpable sense in early March and late March that, you know, something very important was coming, and how everybody had to mobilize, particularly in our team. And as a sort of personal reflection was, you know, a palpable sense that I had to step up to be a leader. I was made clinical lead about a year ago. And, you know, obviously, even though I look incredibly young, I'm sort of apparently in a sort of leadership position now. And so I think there was certainly during lockdown a sense that people were looking to people in leadership roles to try and help steer us through this uncertainty. And that's been, you know, an intimidating, but also, you know, satisfying responsibility that I've tried to do my best to fulfill.
Yeah, thank you. There are a few questions up on Slido. Panellists, I don't think you can see them, but I do have them up on my screen here. I'd like to just come to Adam, if I may, which is about vaccinations. So one of the questions is, could we put a poll up to see how many people would take a vaccine if offered? I think that's a sort of slightly unknown quantity at this stage, isn't it? Could you say anything about where we're at, either with sort of local vaccines, just a sort of overview, really? I guess there are 3 initiatives in this country, but it'd be, I've heard that there are hundreds of vaccines in development.
Well, yes, okay, so there are several different issues tied up in that question. The first is about vaccine acceptance, and there's been a lot of attention paid to this recently as to whether people will actually want to get a vaccine when it arrives. I think the comment I would make on that is that although hesitancy around vaccine has been increasing, or it certainly has been talked about a lot more in recent years, the fact is that people, by and large, are very supportive of immunisation. We have rates of coverage of vaccines for children in this country in the high 90s% in most areas, and we have very high uptake rates for other vaccine programs. So by and large, people vote with their feet, and when they see an opportunity to get protection from vaccines, they take it. On the second issue of where we are locally, as nationally, we're still in the research phase with these vaccines. We don't have a vaccine available that we know works, but we are at a remarkably advanced phase of that, considering none of us knew anything about this virus less than a year ago. So here in Bristol, we actually are the largest recruiting centre in the country for the Oxford vaccine that people will have heard about, with around 1,400 people who've been recruited across the 2 hospital trusts in town. We're tooling up for a second large phase 3 study in the next month or 6 weeks, and we're already in negotiations for a further study before the end of the year. So we're very much contributing to the national effort. Beyond that, we also have a vaccine that we're developing here in Bristol, which is in the preclinical phase. That is to say, it's being tested for safety and effectiveness in animals, which may come through in due course, and which, if it does work, will be enormously valuable because it's an entirely thermostable vaccine. That is to say, you don't need fancy freezers and equipment in order to be able to cart it around. So a vaccine that potentially could reach parts of the world where technology is scarce. So we're well forward, but we're not yet there. And of course, it may be some time before we have vaccines that are effective at all, and quite a long time before we have vaccines that are highly effective.
Okay, thank you, Adam. I'll just let you know that 22 people have participated in the poll, and 91% of them would get a vaccine, which I think is getting close to your herd immunity. I'd like to ask Asha and Anndeloris, actually, working in the community, are there any challenges that you think we need to be thinking about when either the Bristol or the Oxford vaccine come to fruition? Asha,
yeah,
and then I'll come to you, Anndeloris.
Yes, of course. I don't know if Anndeloris would agree, but I can tell you in certain communities, particularly Black, Asian and minority ethnic communities, people are afraid, okay? People are not listening to the government anymore. The government seems to have lost a lot of credibility in all communities, really, but mostly in our communities. They are not immune to all of the information that they're seeing on social media, particularly about what's happening in their countries of origin, where particularly the USA and others are trying to test vaccines. For example, in Africa, where the numbers are actually quite low, and people are wondering, well, why do you want to test it in Africa? Why are you trying to test it in the Caribbean? That there's a big issue at the moment in terms of how the Jamaican government has supposedly colluded with the US government to trial a vaccine on Jamaican citizens. And I'm telling you, Jamaican citizens are having none of it. And that obviously is being passed on to those of us who are across the diaspora. So we have a real big issue to have to contend with in trying to change people's minds. I think they'll go as far as, you know, the test and trace, but if it means sticking a needle in them, people are just too afraid, don't trust it, and yeah, we have a lot of work to do. So here in Bristol, the government has given us some funding to look at how we can engage with different communities, and we're working with our community development team and other organizations on the ground, grassroots organizations, to stand up certain community leaders, or kind of try and bypass some of the gatekeepers to try and dispel a lot of those myths. But it's going to be really difficult. It's going to be really hard, because I think we've just launched this week, or we're about to launch, a conversation and a survey about whether or not people will be using taking up the vaccine. That will be part of the questions, and it'll be interesting to see what the response is. But I think it's going to be, it might be the complete opposite way to the results that you've just shown on screen.
Yeah, Anndeloris, there's something about sort of understanding where people are coming from, isn't there? I think to try to work with this.
Yes, because again, everything that Asha said, I would echo, because people are afraid, because the media has hyped up that BAME are more susceptible. So then if we are more susceptible, why are you picking on us first? Why isn't it across the board? Because you can get it from anyone. So they are questioning the reason, they're questioning the length of time that the vaccine has been tested. How are they sure they're not being guinea pigs? Those are the words that are floating around. And again, as Asha said, why are you testing it in an area that has a very low rate of infection in comparison to where it all started? Again, yes. The language is talking to them, explaining and getting people comfortable with the information, because we are not open with information. We're just giving snippets, and that is making people more uncomfortable.
So that's the thing, isn't it, about trials, about research studies, which is something that I'm responsible for in my own trust, making sure that there's the right information available, making sure that it's in a digestible format, but also you're suggesting there's something about understanding, having an understanding conversation with people to try to see what their anxieties are, and to talk about the information that they've come across and the reservations that they have.
Yes, that is key in order to improve or increase the uptake of vaccination, because everyone, as far as we know, most of these vaccines have been tested over years before it became part and parcel of the system. You're telling us something that happened in a year, and within a year's time you have a vaccine. So where is that balance between the research, the accountability, and the information?
So I think probably there's some conversations for you guys to have with maybe Adam and his colleagues offline after this discussion, because we've got to go onto other things. But Adam, is it proving possible to reduce the 8 or 10 years of research that you would normally need for a vaccine down to 1 or 2 years? How is that being approached around the world?
It's a really important question. So the big cuts in timing are the normal delays that it takes for things to be considered and approved and so on. So the kind of regulatory approvals and so on are being sped up. The actual work itself, has to take the same amount of time. It takes a certain amount of time to get people enrolled into studies and then to observe them and see what happens and make sure that they don't get sick from side effects and that they do benefit from the vaccine and are less likely to get ill. And you can't speed that up. So it's all the in-between bits that have been sped up. But I think the other part of this that's really important is that we in medicine and science are under enormous pressure externally to cut corners and to not do things properly, and we have to hold on to the absolute requirement to do things properly, because otherwise we will stumble into a disaster. We don't want a vaccine manufactured at scale and administered that doesn't work, and we certainly don't want a vaccine manufactured and delivered at scale that is harmful. So we absolutely have to hold on to that and not succumb to pressure, particularly political pressure, to cut corners and not to do the job properly.
Yeah, absolutely. We're going to have to be patient for some time, aren't we? I wondered, yes, you go, Adam.
Well, yeah, it's a bit hard to predict how long we have to wait. My personal prediction is that one or other of the vaccines that is currently being trialed will show at least some effectiveness. But I don't think it'll be the final solution. I think if it works at all, the early vaccines will have some effectiveness, and we'll need to continue to work to improve on that to get the tools that will really get on top of the epidemic. We really need a vaccine that will not just stop people getting sick and dying of this infection, and most of the people that are suffering are the elderly. We really need a vaccine that will interrupt the transmission of the infection through the population, because those are the kind of vaccines that really have impact. And getting one of those is the key goal.
So can I just?
Oh yes, yeah, go ahead.
So yeah, can I just quickly come in, Coach? So again, as I was saying before, we're not going to get rid of the fact that people believe in a lot of the conspiracy theories. But for example, Jamaica has just taken, has just accepted a plane load of vaccines, and somebody posted online the bottle, or the vaccine bottle, and it states quite clearly not to be used in the USA, Canada, Europe. Okay, why is that? So somehow this vaccine, whether it works, I doubt very much if it would be working, But do you understand why people in the Caribbean, in India, and all of Africa, and all of those other countries other than supposedly first world, why is it being tested on us and not on the wider public? So there's a lot of work to be done to dispel a lot of those myths, because some of our governments are selling out.
You're right, Asha, and of course the danger is if it's not a properly run, properly regulated, properly produced vaccine, it's not going to do the science that's being done so carefully, probably by Adam and colleagues in Oxford and so on and so forth. I've got a question about, which relates to this, but it's about public health. If we end up with a vaccine, this is a question from Jane Norman on Slido, and it partly relates to your point, Adam, about the level of effectiveness of a sort of partially effective vaccine. Will we be able to dispense with the social distancing, the face masks, or are they going to be with us for a while, even once a vaccine is found and there's a rollout program?
Well, my answer to that question, Jane, would be that we will certainly need a combination, and for some time. As I said at the end of my previous answer, what we're looking for really is, if we can, to drive down transmission of this infection in the population. And a vaccine will be one tool amongst others that we have in terms of distancing, masks, hand hygiene, and so on, that may contribute to that. I think it's most unlikely in the short term that we'll have a silver bullet vaccine that will just take care of the problem. And bear in mind anyway that even if by some miracle we got a highly effective vaccine that really did the job, you've still got the entire population of the world to protect. And while you might not need to immunize every single one of them, you're going to need to immunize many of them in many different places. So the reality of making that happen, manufacturing, shipping, and then administering the vaccine, particularly in the context of some of the fears and concerns that we've heard about from my colleagues on the panel, that isn't going to happen anytime very quickly. It's going to take quite a long time. So I fear we do have to live with a changed approach to life and social contacts for some time to come.
Thank you. I'm going to gently move us on to staff morale in the NHS. Not just in the NHS, but in all services actually, across health, social care, in charities and organisations that are supporting people. I will come to you eventually on this, Asha, because you've talked a lot about the importance of volunteering, but I'd like to start with Leah and Dan. Both of you have been affected personally by COVID, but you have also worked in high-risk organisations. So the question is, how do we support and motivate staff if we are now entering a second wave? What does staff need to sort of face this increasing rate of infection? So Leah, I'm hoping your audio is okay. What do you think we need in caring professions?
I would say definitely the quick right PPE, because there was places where I worked that didn't have it at the beginning of COVID, and they were making staff wear masks for 12 hours. They didn't have any visors or any head protection. So basically we had nothing but only masks, where I think now we should have full PPE where it covers your arms so that you're completely covered, really. I think we should have hats, and because in hospitals they've got everything. When I was in the hospital they had everything, they had masks, visors, hats, aprons that came down to their arms, they were completely covered. Whereas care homes, they're not being cut, they're not having the right PPE. They're just giving you aprons, just that only just cover your down to your legs, but not your arms aren't covered, or your rest of your body's not covered with them. It's only literally on down to your just the apron. That's all you've got, and gloves and masks. That's all they're giving us.
So making sure that we've got the right protective equipment for the staff going into those organisations.
Having enough of it, because some places they were saying, oh, there's not, you can only have one mask because we're only limited, we've only got one box that's got a last, whereas other places are saying change the mask every 2 to 3 hours. Some are saying wear the whole mask for the whole 12 hours that you're doing. So it needs to be more clarified how, how long you're supposed to wear the mask, because obviously people aren't aware of it.
So the same, you work in hospitals as well, and you're looking for something similar in all the care homes that you work in. I think that's really important. I mean, Anndeloris, you're in a community-facing organisation. I mean, at the moment you're working remotely. Do you think that's how your organisation will carry on dealing with this?
Yes, and for my service users, what I was advising them is to be able to have separate clothes for people coming in and out the house. And ideally, I would have liked if we had like disposable gowns, because I worked in theatres in the past, and you have those light, flimsy disposable gowns that would cover you right up to the wrist and the glove, so that all their clothes is not exposed when they leave one person to go to the other. And for me, is like barrier nursing, which is not being the principle that guiding everything, which will minimize the amount of infection that is traveling through. Hopefully, one day we'll get everybody standardized, because we focused on the hospital, but we didn't focus on the care homes and the people who do in domiciliary care, because they're wearing their uniform to go from house to house. And a gown and a mask doesn't, an apron and a mask doesn't cover it.
Yeah. I think a lot of organisations, this is a topic that's received a lot of discussion. I think as a psychologist, I'm interested in the psychological aspect of going into the next wave as well. So Dan, you've been leading a team that's worked in an emergency department during this period. Emergency departments work hard anyway, but what's your approach to supporting and motivating your colleagues and your teams going into this next wave?
Yeah, well, I mean, I kind of reflect and sort of reiterate some of the things that Leah has said, about PPE and so on. I think the really unique and interesting thing, if you want to just look at it academically, about this whole pandemic so far is it's almost impossible to separate out the professional pressure that people are feeling at work from what it is that they're encountering when they step out of work. And that really is, I mean, let's not use the word unprecedented, because it's been overused in the last 6 months, but, there's no major incident or terrorist attack or anything like that that really sort of feels quite the same as that. So you're talking about staff who are coming to work and they're frightened about their health and they're frightened about PPE, but they're also going home to families and loved ones who are suffering the same kind of experience. And that's been really difficult to tease apart. And, along with it, of course, whilst the clapping on Thursdays that you will all remember was, for me, actually, hugely poignant and really quite emotional and impressive, and reflect some of the most fantastic elements of our society, it was also a bit worrying, right? Like, NHS staff don't particularly want to be martyrs. They just want to come to work and do their job to the best of their ability. So, I think whilst, you know, I'm not a hugely cynical person myself, I did understand some of the cynicism that said, you know, please stop clapping, just make sure we have enough PPE and pay us properly. You know, that was what some of the nursing staff and the domiciliary staff and so on were saying. And so, you know, I think we have learned some things from the March to September period. Whether we've learned enough to really give us the resilience to ride a second wave, for want of a better analogy, I think some of that will remain to be seen. I think, you know, that some things have improved. All I'm telling my staff, and I can't speak for the NHS as a whole, obviously, what I'm telling my team of 120, 140 people is we can be absolutely certain about the uncertainty. There's still no way of predicting completely what's going to happen. But I think, you know, NHS staff and, you know, the kind of community staff and, you know, some of the care home sort of setups, I think we can all hang on to the fact that we have shown that we can mobilize very fast. You know, some of the red tape that Adam was alluding to about vaccines, you know, in the NHS, in the first 2 to 3 weeks, we pushed through changes that would have taken years to get through in the very beginning. And so I think we have shown that as a society and as an NHS, we can do things very fast when we want to. We can come together very quickly when we want to. And, you know, there's very little that we can't do together. And that's the kind of, that's the context I'm using, I guess, for morale to kind of take us through the second phase of this.
Thank you, Dan. We're going to go to a break at 4 o'clock, so that gives us a few more minutes. Asha, I wanted to come to you really because you are involved with so many aspects of life and community in Bristol and so many organisations. So I suppose I was wondering, how are you approaching this, not just with council staff, but with other organisations that you work with, this possible increasing rate and second wave, which we're always a little bit behind, aren't we, in Bristol compared to perhaps the north of England. But what advice and ideas are you putting into practice in relation to that?
Okay, so the one thing, I think one of the things, it was interesting to listen in on a call about why are Bristol cases so low. I don't know. I really don't know, other than the fact that I have to say I take my hats off to the citizens of Bristol. I think during the time of, you know, the first lockdown, I think well over 85% or more of the citizens of Bristol were really compliant in terms of kind of lockdown procedures. And even though I do know that you said do not make any jokes about Cummings, but the Cummings effect has actually had an impact, particularly for young people. And obviously we're seeing, you know, the increase in number of people who are refusing to follow government guidelines. But the one thing that we're doing here in Bristol, and we're taking very seriously, like I said, we have stood up, we have the Health Protection Board. We've put in place a very robust and detailed local outbreak management plan. I co-chair the Local Engagement Board, which is like another mini version of our One City boards that we have. So we have all of the key public, private and voluntary sector key partners who have wider membership and audiences, so that, and we meet every other week. We are sending out messaging. As I said before, we have a budget, and we're using that budget to ensure that we are providing a kind of localized response to shore up the government guidelines that we have. We're trying to ensure that we're not going to demonize young people, because I think at the very beginning, when young people were talking about young people, we're seeing an increase in the number of young people. Again, we're not here to demonize, but we want to be able to educate. So I've just asked the team to make sure that we're inviting some of the university, one of the vice chancellors, to join us on the engagement board, so that we can ensure that their messaging you know, corresponds to the messaging of the whole city. But huge amount of work to be done. But again, I would also would say that the way in which we are communicating across the city, I think right from the very start of the lockdown, we were providing daily updates via email to hundreds, if not thousands, of individuals. We stood up and we are still providing a kind of weekly briefing newsletter that is sent out in the name of the mayor, just keeping everybody updated, and just flooding the city with as much information as we can, using the radio. I think Marvin does regular Facebooks. I'm on Ujima every couple of weeks, giving people an update. So we are doing everything that we possibly can, and then some.
Thank you very much. So we are going to just take a brief break now, which will give our panellists a chance to recharge and our audience a chance to add some more questions. We will come back at 4:10, and then we will have a chance to have a few more questions. Dan, I think you've got to leave at 5:30, but otherwise we're here till 4:40. So we'll have another half an hour of questions after the break. Okay, thank you very much. We will see you after the break. Good afternoon. Welcome back after the break. Thank you for the questions that we've had up on Slido. I will come to those in a second. I'd just like to, if I may, indulge Chairman's prerogative and ask a quick question of the panel myself. So thinking about COVID-19 as almost a wake-up call in a way, in the way that it's caused us to reflect and think about things. As a psychologist, I liken this to us being sort of shut away in our homes a bit to reflect. It's a bit like doing therapy on your own without the interference of a psychologist like me. But we're all sort of having to do some of that. But I wondered, from your points of view in your different roles, what should we have woken up to, and what should we do now that we're awake? So I'm going to go in the same order that I originally introduced you. So I'm going to come to you, Adam, first.
Thanks, Julian. So, this has turned out to be much more than a virus. This has turned out to be telling us some truths about how society works, and in particular, how unequal society is. And it's not just in terms of what the virus does, it's the resources, it's the way we treat each other. And for me, the inequalities that have become evident over recent months in many countries, particularly in Europe and North America, most evidently, to me as an academic, as a teacher, it makes me grieve for the waste of talent. There are so many people who could contribute so much, not only to overcoming this pandemic, but all the other problems that we need to tackle and that we have to face. And yet, because of the inequalities that exist in our society, whether it's from people from minority ethnic groups, from relating to gender, relating to background, relating to poverty, it means that there's this extraordinary waste of human talent, and we owe it not only to those people to give them a fair chance, but we owe it to ourselves to tap into those human resources that currently we are wasting so badly.
Yeah, absolutely. I mean, you're probably going to have a comment on that, Asha, but I'm going to come to you next. What should we be awake to, and what should we do now that we're awake to it? Oh, you're on mute. Sorry, I'm going to see if someone might unmute you kindly for me.
There you go. I'm fine, thank you. So I have been describing COVID-19 as an earthquake that has really revealed the ugly reality of racism, poverty, inequality, and discrimination in society. We know it's systemic, we know it's endemic, and we know that it's structural. And we've seen it through the disproportionate impact of the virus on both cases and deaths of Black people, the murder of George Floyd, the drowning of that statue that sparked a global reaction in which Bristol has been right in the middle of the storm. And obviously with the resurgence of Black Lives Matter movement, which has offered all of our sectors, including the public sector, an opportunity to change course. It's given us an opportunity to confront inequalities of power, thinking about how we adapt new models and new ways of working. It's forced many of our institutions to review our structures, our organizational cultures, and the policies that we have in place that actually are many of the root causes of the inequalities that those many communities are facing. So the new normal for me must have diversity and inclusion at its core, and also embrace class, like I said, poverty and race. And that realization that communities are on the front line of the pandemic, and we need to move those communities, and particularly the volunteering community sector, from the margin right into the mainstream. We're not bit part players in this anymore. We have proven time and time again during this pandemic that our volunteers and those communities who have no voice and are largely excluded from the mainstream are the ones who have just jumped up and kind of got into the mix to support individuals. So yeah, that's what I think. And we've already started the journey in the local authority. We'd started it over a year ago, and I think whilst we were in the middle of the pandemic, the realization, and I think particularly for many of our staff in the organisation now, people are saying, yeah, hands up, we kind of get it, but we also want to learn more. So we've started to put in tools for managers, toolkits, resources, training and support, so that people do understand the extent of what institutional racism and discrimination looks like, and how we can all put our shoulders to the wheel to address it and hopefully eliminate it.
Absolutely, and just to be completely explicit, we've had this discussion before, but for me the challenge is about, as a very privileged, middle-aged, middle-class white male, how have I used that privilege? What have I done to understand, to educate myself, to address things, to become an ally?
Allyship is, so that is the one thing I will say to everybody. Talking about race is uncomfortable. I say it all the time, but I also say, how uncomfortable do you think it is for people like me and Anndeloris and those of us who are othered all of the time? Whenever you talk about race, people pivot, want to talk about gender, they want to talk about anything else other than race because they don't get it, they don't understand it. But you know something? The death of George Floyd, I think, just it just touched people's conscience. And it was kind of like a light bulb moment has gone on. And I actually commend all of those, and it's all white people who have said, you know something, I need to check myself. I need to look at my role in all of this, and I want to do something about it. And I have to say, within Bristol City Council, myself and the Mayor have had conversations now with a few hundred staff over Zoom, obviously, to start those difficult discussions, but we have stood up, and I'm more than happy, anybody online, we will share some of those resources, we will share the journey that the council has been on, and you can look at the actions that we're taking to make a difference.
Thank you, Asha. So I'm going to come to you next, Anndeloris. We are still talking about what should we be awake to? What does the pandemic woken us up to? What should we be doing?
The pandemic has awoken us to a bit more communication, and not just talking, but starting to listen. And if we don't listen, we won't hear and we wouldn't understand. So we need to take that time out. When we ask a question, listen to the answer. Because we just hear words and we act on words and we pick and choose what we want. But listen to the person who is answering the question. Because if you don't do that, you will still be going back into that recurring decimal and no change will happen.
Or when we talked before, you know, I like sort of sorting things out, you know, it's that sort of, don't be careful choose when to rush into a solution, you know, take your time to listen and understand first.
Yes, because sometimes we want to put a plaster on the sore, but we don't realize how deep the wound is underneath there. So we need to be able to give it time to see how much depth it is, how wide it is, before we try to put on a sew. Because sometimes the individual may have the answer, they just needed to talk it through to someone to hear what.
I think we've lost Anndeloris. Is that right? I'm waiting for a message to come through, but I think we have lost Anndeloris. That's a real shame. I'm hoping that she's going to come back in. So she's dropped off the call. I'd had a discussion with Anndeloris about this before, and I think the cautionary note that she was making is that when you talk to someone about racism, when they've suffered racism, you are potentially going into trauma. And the point about being kind and listening to what people have got to say, which to an extent all of you are making those points. So Leah, I'm going to come to you about what we need to do. What's your view? And I noticed that you've put something in the discussion about reflecting on people who've come through having COVID, as you have done. Did you want to say something about that?
Well, yeah, I just think that when I was in hospital on the ward, it was kind of all you heard in the news was COVID. You know, it was always a negative. It was never any positive. And when I was in hospital, me and one of the nurses and the carers were talking, and I just said, you know, when you hear COVID, it's quite scary because people were saying, oh, you know, so many people have died, and that was always in the news. It was never about the actual positive or about the people that survived, you know, or the people that got through it. Because I mean, the nurse said to me that like they treated about 2,000 people went home from COVID in hospital. I mean, when I was in there, I mean, I was put on high dependency after 2 days of being in hospital because of my temperature, and obviously because I'm asthmatic, so they couldn't get my temperature down. And I actually thought I was going to die when they said to me they were going to move me to high dependency, because I was quite scared, and because I'm deaf as well, I felt very isolated in the fact that communication was a real big issue for me, because obviously I couldn't lip read people like I normally would lip read them or sign, but nobody was able to sign and nobody were able to sit their mask down. So for me, it was a real big, very big issue for me, because I was more isolated, and I was quite scared that I was really going to die. And obviously the nurses were like, no, you know, we've seen 2,000 patients and we've managed, you know, that they've gone home. And I said, that's the thing, that everybody, we all of us as professions, all you know, we've all been here and we've all had to support each other, but all we hear is the negative, and we should all be, you know, very proud of ourselves that actually there is positive about coronavirus. There are people that have got through it, you know. That should be an important message to all of us, that we should take, you know, that there is the positive that people, it's not all negative all the time. It is positive that people are surviving.
And getting better. I mean, I wonder if you could say something else about your experience of what helped you come through that experience of COVID. I mean, both the physical side of it, but also the psychological sort of mental impact of being ill for quite a long time and seriously ill.
For me, having my daughter who's 9, because I've got Magnus disease, which is obviously an ear problem, she's a young carer at home, and for me, I just knew that I had to fight the coronavirus, because obviously for my daughter, my husband, my family, and you know, I don't think it would have been very nice if my daughter was only have her dad to look after her. She needs a mum as well, and it was kind of and every time she would ring me in hospital, saying, "Oh, mummy, I hope you come home," and obviously I was getting worse at that point, and it was just seeing her face most days crying. But she was amazing. I mean, because my husband also was very ill with coronavirus. So she was actually kind of just had to really mature, really, to be honest. She had to make herself food, to make sure her and her dad were all right. She had to make sure he was giving him food. And, you know, she's an inspiration, really, because she's just was able to, prepare sandwiches, prepare, spaghetti and bolognese and spaghetti meatballs. She can do a lot of things now.
So yeah, and I know that you've been proud that she's 9, isn't she? So she's had to grow up fast, and you've been proud of what she's done for you and your husband over that time. I wonder if I could come to you, Dan, as someone who's had COVID as well, and say what from your experience, perhaps as a patient and as a doctor, what do people need for recovery from this virus? Not just the physical recovery, but the psychological recovery.
Yeah, thanks, Julian. And I'll make this my last comment all wrapped up in one, because I'm going to have to go to work, I'm afraid. Well, I'm sort of at work, but go clinically to work. So, I mean, what do people need to recover? Well, I count myself as pretty lucky. I seem, for reasons that I can't quite explain, to not have that many side effects afterwards. There's obviously quite a lot evolving in the literature about all sorts of, quite nasty and long-lasting side effects, which, fortunately, I don't appear to be experiencing. I'm a little short of breath going up the stairs still, but that may just be because I'm a sort of evolving and very unfit 41-year-old anyway. I mean, let me combine it with your question, Julian, which was, what have I learned, or what have people woken up to? I mean, I think, we've learned that anyone is susceptible to this virus, that there's certainly higher risk groups, but, I'm a marathon runner and I'm only 41. And, I was pretty scared, like Leah described, and I watched my oxygen levels, my oxygen requirement rising, and I had some pretty frightening conversations with intensive care consultants. And, there are lots of anecdotes out there of health professionals who've died from this virus. So whilst there is positive news, as Leah comments, there's a lot to be worried about. And I think, this is a good time not to believe conspiracy theories. And I was interested what Asha said. This is a real virus, and it's really making people sick. And if people choose to ignore those rules, and I'm not so interested in the politics, but there's some pretty consistent messaging required from our government that makes sense to keep us safe. If people choose not to follow those rules, then we all have to acknowledge that this, it could be a problem this winter for us. We've also learned something about our healthcare systems. We are not the only city in the UK to have seen emergency department attendances plummet during the virus at its peak. And it wasn't because people suddenly weren't getting ill, as people were making responsible choices, I think, about their health and about health-seeking behaviours. And emergency departments that are filled to the rafters in the winter, that's something we need to really look carefully at, and why that's happening. And I think as a society, we've got to kind of really look at how we're using the health resources that are available. And then my final point about what we've woken up to is about how much we need each other. You know, the irony is that at the exact same moment that we have been trying to limit our personal contact with our friends and our families and the people in our community is the exact time that we've really learned just how much personal contact matters. A touch, a hug, an embrace, you know, a conversation with somebody without a face mask on. And, you know, I think there's a lot for us to think about there moving forward about, you know, in this sort of increasing world where we can do everything alone and digitally, just how important those human connections are, not just in terms of spreading the virus, but in terms of keeping our mental and psychological well-being in check. And, you know, we are social animals, and I think this virus has certainly taught us that if it was ever in doubt. Anyway, I'll have to love you all and leave you all, I'm afraid, and not stay for any comments, but it was good to talk to you all.
Dan, thank you very, very much for joining us. You take care. I hope you have a relatively quiet shift. Okay, thank you. So there's a question about keeping the focus when we're in a pandemic. So the question that's come up is to do with how do we keep a focus on broader issues like climate change when we're in the midst of a pandemic. Adam, I'm going to come to you first as a cyclist, but also just to mention that we do have Zoe Banks-Gross, who's going to be talking partly about this in our one of our Thursday interviews later on this week. And I think that one of the things that happened soon after the lockdown is that actually the amount of traffic reduced considerably. So those of us on two wheels and maybe not having to travel to lots of different parts of the region like me were enjoying that reduction in traffic and much more cycling. But I'm just interested in your perspectives really on this has been an all-consuming thing. How do we keep a balance really of focus on these other issues?
So thanks for asking me to comment as a cyclist. I do quite a lot of my cycling in the Alps, and I can tell you for sure that climate change is a reality, because when I cycle through Chamonix and look up at the glaciers, they get smaller every year. And looking back to the 1980s when I first went there, the big glacier that comes down off the mountain of Mont Blanc is about 1 kilometer shorter now than it was then. So climate change is surely happening. But to try and address your question from my personal perspective, we really do have to confront this problem day to day in the world of clinical research, because this pandemic has actually stopped a very large number of really important research studies right in the middle of when they were being done, and ruined their chances of delivering any kind of useful result, which is a terrible waste. And of course, a terrible cost to the patients, in my case, children, in my colleagues' patients are mostly adults, but people who really will lose. They will lose their health, they will lose their lives because of the interruption of that life-saving research. And it's done similar things to clinical practice. We hear figures of cancer deaths that we are going to have during the course of this and subsequent years as a direct consequence of the delays that the pandemic has imposed on normal diagnosis and care. So even just within medicine, this is a real phenomenon. And of course, medicine is just one part of the world of life that we all lead. And it's impacting on all sorts of other areas too. So we do have to retain some kind of balance. And although we're pulling people together and putting all our energies into overcoming the pandemic, it's not like we can forget about everything else in the meantime, because other people's lives are going on and other problems continue to exist. So I really do think we've got to balance this up in some way. We can't just devote ourselves to this one problem and forget about all the rest.
Asha, I'm going to come to you briefly, and then we are 5 minutes off the end of our panel, so I'll then go to our final sort of quick fire question. But I mean, I guess your job is all about achieving balance with a massive number of priorities.
Yeah.
So how are you balancing this one against things like healthy environments in Bristol and the surrounding area?
So what I would say is that, I know it sounds really weird, but COVID-19 has also provided us with many great, it has a silver lining obviously, because it has allowed us, and many of us, to actually expedite many of the the ideas that we had around tackling air pollution. So as you know, we've basically changed up the city centre, the old quarter, and shifted things around in relation to rediverting traffic. We have been communicating through our ward councillors and citizens around potential kind of road closures. We're also conducting, it actually now ends today because we did extend it, but we're the only local authority in the country that is communicating using the recovery process, engaging with the community and using a deliberative democracy approach to ensuring that people engage with this process. And I can tell you now, because I meet every other week, I'm leading on this work with Councillor O'Rourke. We've had now over 6,000 people respond to the survey. I've seen the emerging results, and of course, climate change, climate emergency, transport, air quality still remains very high on people's agenda, but also there's employment and skills and health and mental well-being. So we are now actually going to start the process of getting these down to, what we want to find is what are the contentious issues that the city can't agree upon, and they will form the basis of the discussion for the Citizens' Assembly / juries going forward. So yeah, it is really, really difficult, because I could see the frustration people who were sending through, they were tweeting about, oh, what about iRoad? What about this? What are you going to do? Everybody's issues are a priority. But what you've got to remember, it's also in the backdrop of us. I don't mean to be political, but the reality is we're not getting back the money that we're spending on COVID, and actually, the demands of the city are on the local authority, which I would also remind everybody, it is not the city council, it's not in our gift to deliver zero carbon emissions by the end of 2030. It's in the gift of the whole city. So it's everyone's shoulders to the wheel. So it has allowed us to move quicker and faster on some aspects. It's upset some people are applauding that, but that's what happens. You can't please all of the people all of the time, but we are going to take advantage of it.
And it's a good point, isn't it, that all of the things that we've talked about today, COVID-19 and infection control, racism and fighting injustice, and getting some of the wheels turning to improve climate change, but also getting things like research and the NHS running as it needs to. There's a combination of organisational response, but also people's individual responsibilities.
Mm.
So I think we'll come now in our last couple of minutes to my last quickfire question before I thank you all for participating, which is to do with what you're looking forward to. And Anndeloris, I'm sorry, you dropped out briefly earlier on, and I just referenced a discussion that we'd had about talking sensitively to people, but just tell us something about what you're looking forward to, perhaps personally or in the organisation, Bristol Black Carriers, that you run.
Personally, I'm looking forward to growth. Professionally in Bristol Black Carers, I'm looking forward to growth because COVID is here, but life still exists. And things are still happening normally, despite the fact that COVID is here. It just might have slowed it down a bit or caused people to step into some crisis. And it has allowed people, from my perspective, to start looking at themselves and knowing what their roles are, because a lot of people do not identify as carers. And because they don't identify as carers, they have never asked for assistance. And COVID has now forced them to look at it. I am a mother, but my child is ill and I need to do these extra things. But I just thought it was because I was a mom. And other people within their families have now realized it is an extra job. And it's not something, we keep referring to carers as unpaid carers, but they're not unpaid carers, they're carers because it's a 24/7 job. And the other people who provide assistance, they are just care assistants in whatever capacity, whether it's a registered nurse, a healthcare assistant, or somebody dropping in. But a carer is a carer 24/7 because they provide emotional, financial, physical support in all different ways, and it never stops for them. So we need to give them that credit within this time. And as COVID has hit, their work has trebled.
Yeah, and I think I'm going to come to Leah next, but her daughter was a good example of a young carer really stepping up at a time when her mum and dad needed it. But Leah, it's been a long it's been a long year for you, hasn't it? So what are you looking forward to now over the next year?
I'm looking forward to hopefully next year going on holiday, and having time with the family and enjoying life, trying to block this year out. But equally, I'm looking forward to the fact that now in care homes, especially when I worked yesterday, they're actually now doing agency staff they're testing for COVID every single week. So they told me yesterday that because I work in this place a lot at the moment, that I'm entitled to be tested every week for COVID. So they're going to be doing testing. So that obviously, hopefully, that I don't get it again, because obviously I don't want that again. And I still have issues now with obviously getting, I keep getting chest infections since COVID. So I think, which I didn't have before. So I think it's made asthma slightly worse than what it was before. Yeah. But definitely looking forward to hopefully being tested each week, so knowing that that I'm going to be safe and that I'm going to be able to be here for my family and my daughter, and making sure that we can have a happy life and hopefully go on holiday next year. What I'm really looking forward to.
Well, I hope that for you as well. And does that resonate, Asha? The idea of a holiday? What are you looking forward to?
Yeah. So off the back of what I've just said about air quality, well, you can't deny. I have got African and Caribbean roots, so I need to go and see my people. So yeah, I need a holiday. I took a holiday, believe it or not, during the summer, like holiday at home. And I was between the bubble of Bristol and my children who live in London. And they disowned me. They said, you can't be on holiday if you're constantly on Zoom, which I was, because actually, usually August is a quiet month, but with everything that is happening, I'm not off duty, unfortunately. So
it hasn't slowed down, has it?
It has not.
Adam, what are you looking forward to over the next year?
Well, I'll make my answer brief because I know we're running out of time. As you pointed out at the very beginning, I've been a qualified doctor for nearly 40 years now, so it's tempting to say well into my 60s that I'm looking forward to retirement, but there's no real prospect of that in the short term. I think I would answer that I'm looking forward to an end, or at least a reduction in all the suffering that we're seeing at the moment, not just from people who are infected by the virus or lose their loved ones to the virus, but all the other negative consequences in society that is taking its toll on so many people. And I'm really looking forward to seeing some signs of a resolution of that. Thank you.
Okay, thank you very much. So we are a few minutes late. I'm sorry about that for those of you that need to go. But to bring this to a close, I just need to thank what's been a fantastic panel, wide-ranging conversation over all the important issues of our last few months. So thank you to Dan, who's already gone, but Leah, Anndeloris, Asha and Adam for being so thoughtful and open in your discussion today. I want to thank our colleagues behind the scenes who've arranged the whole conference, but also Autumn Live, who've been running the technicalities. So thank you to David, our director, Lisa, Ollie, Louise, Jan, Carla, Rachel and Sabrina, the Bristol Health Partners team, who've set this whole thing up, been organising my ridiculous diary to get these fantastic panellists on board. You've been epic, and you panellists have been epic, so thank you very much. To the audience, I hope you all have a safe trip to the kitchen for a cup of tea, or to the loo, or out for a walk in what's left of the sunshine, not very much of it. And I look forward to seeing you all again on Thursday for some interviews with some other inspirational colleagues from Bristol. Thank you very much.
Thank you.